We got a couple minutes before we go live. Hi, everybody. Welcome to the Medicare Cafe. Right now we are on the pre-chat. So welcome. My name's Olivia Richardson.
And I'm Kari Vogt.
And we are back together again. There has to be a good song. Reunited and it feels so good. Nailed it.
Not a singer.
I don't know how we haven't been discovered yet.
I don't know. Probably I'm holding you back.
Holding
you back, probably.
Welcome, everybody. So for those of you who are watching the recorded version of this, you might want to skip ahead about 3 minutes. We like to go live just a few minutes early to just kind of answer any questions, even though, like, today is an Ask Us Anything. So we'll probably
just continue the pre-chat.
Continue the pre-chat. But today, we're kind of just to kind of get caught up on things and how life and the world is doing. Happy post-Labor Day. You're not allowed to wear white anymore, I guess. Is
that rule has totally gone away.
I was going to say, I still wear white, but I do it kind of like...
I feel like it's off-white.
Okay.
Like, I feel like everybody wears, like, off-white pants in the winter.
I
don't really know the difference.
Starch.
But yes, I feel like that went away.
Yeah.
I remember asking, I have a good friend who's, like, does fashion in Chicago.
Oh, so she's like, real trendy. Okay.
Yeah. And she'll just, like, send me clothes. And I'm like, so there's no, like, rules anymore. She's like, there are just no rules in anything, really.
Nothing. There are no rules.
There are no rules anymore.
There are no rules. So, so that's about all I know about Labor Day. The only other thing is that I was just I got a puppy.
Yeah.
I got a puppy. It's a German short-haired pointer. Had no intentions of getting a puppy anytime soon. But literally my husband just sent me a picture of this puppy. He's like, what do you think? And then, so he sent me the picture on Wednesday. We went to look at the puppy on Thursday. We brought the puppy home on Friday. And that was the first we talked about getting a dog since. We had a Weimaraner that passed in February.
Oh, God.
Early February. So we just
tired.
were, I'm so tired. I'm so tired.
Did Cade love him, though?
Cade loved the idea of a puppy, and Cade loved...
hey, Brian!
Cade loved the idea of a puppy, and he loved him for about the first 30 minutes. And then my 3-year-old learned what it was like to have a sibling, and isn't a fan of sharing attention.
Yeah.
So
good practice, right?
Nope.
Practice.
That's why we got a dog. It's because we're done with the children. Red underwear under white pants. It shocks people all the time. Listen, Sherry, I'm gonna take a rule out of. I like her style look. That's what I'm gonna start doing. People are gonna.
I can honestly say that's something I've never done. Red underwear under white pants.
I'm going to now. Now that I have
Should we start the trend?
I'm gonna start the trend. Listen, I'm not saying it's gonna catch on, but I'm gonna have a good time. So, did you do anything fun for Labor Day?
Wait, she's being serious. It really is the only color that truly doesn't show.
No way. I don't. Sherry, listen.
No way.
Sherry, you and
Are
I
you
have
being
been friends
for real?
For a very long time.
I think she's being serious.
Oh my God, Sherry, I'm gonna go home. I have a pair of white pants that are, they don't leave a lot to the imagination if you're but I can't imagine bright red isn't going to just look like my butt, look like a stop sign.
Yeah.
Right?
Look up Confidentially Yours.
We
just
learned
something today.
On Sherry's side of this. Listen, Sherry, I'm not saying I don't trust you, but I am going to test the theory first.
Yep, got to test it personally.
Yeah. She teaches me something all the time. I don't have any family members that are like in fashion or like friends who just like, this is what you do with your life, Olivia. I need, where do you find these friends? Michelle and Sherry are my friends. You're holding out on me.
But I even her hand-me-downs that I get, I'm like, I don't know if I can pull that off.
Yeah.
So much of that trendy stuff. I'm like,
you have to have it's a personality trait.
Yeah.
You have to have in order to be confident.
It does.
In those outfits. So, well, for everyone else, that's hilarious. That's the funniest. Okay, guys, so for everything else, we can still keep talking about things like that because today on Medicare Cafe is an Ask Me Anything. Which essentially what that means is that leading up until today, we've been doing a lot of AEP prep. And last week we did, what do you need to do in the month of September to make sure October 1st you are rock and rolling, ready to start writing? Today we have Kari back. I'm so really excited to have Kari here.
I think it's been 5 weeks.
I know. Well, it's just, again, craziness.
Yes. So I will be back regularly, though, again,
starting today, you're every other week now.
Every other week.
So, which is awesome that we can do that. And so you guys can talk to somebody who's actively out there in the field, writing, prepping for AEP like you are. So if you do want to go ahead and ask us your questions.
AEP's already started, though. The last month for me has been, I turned in, 13 apps last week or something.
Oh, geez.
I was like, is this AEP?
So, okay, because I always say that, and I'm always joking that, I feel like AEP never finished. I feel like I haven't been outside of an AEP, in all seriousness, for the past, 3 years. I've not noticed a single slowdown. The only slowdown in the year that I noticed is December 15th through January 3rd, January 2nd. That's really the only slowdown I see, period. So tell me, but you're actually talking about, you're writing apps.
Yeah.
Why? What is it, people turning 65? What's the sitch?
Yes.
The sitch. Hi, 2003.
All T65s. I've had, not all 65s, just new to Medicare.
Okay.
I had a bunch of August and September birthdays and people just retiring.
Mm-hmm.
And they just hit it.
And how are they finding you? Are these through your same avenues as always?
Strategic alliances.
And that's all for everybody else, networking partners.
Networking partners, yes. Yeah. Networking partners. And I had a unbelievable networking partner event about 2 weeks ago. I spoke to a group of 60 Edward Jones advisors.
That's so intimidating.
But I spoke for an hour and 45 minutes.
On a Medicare 101?
Yes.
Wow.
It was the Medicare 101, and every single slide there was 10 questions. The guy hosting it was you have to let her continue. No questions on this slide. But it was awesome. It was one of the most engaged groups ever. But what made it so good is there were 30 advisors, and all of them had their assistants. And that I love, because so many times it's the assistant who's doing the connecting.
That's for the assistant, such a good point. Yes.
To know me and know everything too, I think that just made it so successful.
I think, I'm working, we're working with actually on the integrity level with this group of lawyers. And these lawyers, they're estate planners, things like that. They're we want to get into Medicare. And what I tell them is I appreciate that your office.
They want to get into Medicare insurance?
Yes. I said, your office should get into Medicare. If you think for a second somebody who's used to working and charging by the hour is going to start doing commissions to where all the upfront work is free, I said, no. So you need to have somebody in your office do this. You don't need to do that. And so that is such a great point that it's oftentimes the person in charge isn't the person that you really need to be talking to with the administrative team as well. So that's really interesting. I love that.
Yeah, it was a really good one.
So again, if you do have any questions, we already have some questions that are coming in. If you do have any questions, you can text this number right here. That is my cell phone number. That is, I'm reading it live. Also, if you're doing the recorded version of this, you can text that number anytime. I don't just respond during the show. I will respond during the working hours, mostly, but at sometimes at night whenever I'm dealing with a screaming puppy. It's nice to take my mind off that. Or of course, you can do it in the message box as well. Feel free to message us and we'll answer your questions for the next 20-ish minutes or so. So
what's
one
first question?
Are we expected to change our number of companies and plans that we represent for every different location? So what we're talking about is the new rules that are going to affect actually September 30th. That's talking on every sales appointment and every piece of marketing that you have to do the disclaimer, I represent X amount of plans out of X amount of plans. And unfortunately, right now there's a lot of, the funny thing about what compliance is doing, CMS says what compliance is. They tell the carriers try to interpret it, and then the carriers tell and enforce it, and then the carriers tell agents and tell us how they're interpreting the rules, and sometimes they don't always match up. It's all interpretations on the level of the carriers and then also us as well. So kind of two things. What at the root of the rule, what that does say is if I'm talking to Kari, and Kari, I know you live in Boone County. I have to tell Kari Kari, I represent 28 plans out of 45 available in Boone County because I'm talking to one person. So every time you're on a one-off, you do need to be able to do that. However, this rule also applies to like marketing materials. And a lot of times you don't want to do, here's my Boone County marketing, here's my Callaway County marketing, here's my Illinois marketing. Yeah. So one of the workarounds that a lot of carriers are recommending are basically combining the service areas that you work in. I would keep it to states. So like if you work in 40 counties in Missouri and 30 counties in Illinois, do a Missouri one and Illinois one. But just total all of it.
All of it.
So in Missouri, I represent 430 plans out of the 620 available. It's very specific numbers. I totally made up, but still, that's really high. I doubt if that makes But if you're doing it to a service area, just total them all up. If you're on a one-on-one meeting, it really is best to say for that person.
So I'm trying to think of my email disclaimer. Like I have it at the bottom of my email.
Mm-hmm.
But I mean, I'm also licensed in 10 states. So, like, would I have to change my email disclaimer with every person? Like,
honestly, it is, that's what we need to figure out because it's not communication, it is marketing pieces. So, if you're going to be discussing any plan details or anything in those whatsoever.
I do sometimes.
Yeah, of course. Then, in that one, you would need to say.
There's no way to put it, like, nationally.
And again, if you are,
it's
gonna make you look bad though, because if you say out of these states, you're not gonna represent a fraction of the plans that are available in that state. So it's gonna make I represent 12 out of 200 plans. Like that's not gonna make you look good. It's not gonna make it look like you have a lot of options, even though in their area you do. So, but it all comes down to ultimately what our compliance officer said is all in good faith. As long as you're showing that you're doing your best to not be misleading, you're going to be okay.
Okay.
It's all in good faith. So we actually had some people this morning. I was working with a case with my agent resources team, Sean, and he was saying, I have an agent that's trying to do all their marketing pieces and get ready, like we're telling agents to do, and have their marketing pieces ready to go October 1. Mm-hmm. However, we won't know how many 2014 plans are available until after, when the landscapes come out, which is the end of September, and that's not enough time. So it all comes down to in good faith. You have to do best. So what we're gonna do is recommend to the agent, use 2023 numbers for now and just print a small supply of them, and then as soon as we get them, go ahead and make your bulk supply after that. But have something so you can at least get started in October. But it's all in good faith. Just do the best that you can, guys, and you're going to be okay.
And it's going to be way easier to do it by state than county. Like, I'm just planning on doing it by state.
Let me see. So hopefully that answers your question. The answer is yes, you are expected to do that, but it's all in good faith. Just do the best that you can.
Michelle says the unfortunate thing is that you have to state the plans, etc., in the first minute before you even know what county they are calling from.
So reminder, Michelle, that is in the first minute of a sales appointment. The thing that's you have to say that's within the first minute, that's of a sales appointment. That disclaimer doesn't have to be said on every phone call.
Okay.
Just the first one, it's the first 60 seconds when you have to note or have to mention the state pharmaceutical, the state assistant programs and things like that. So at that point, you may know what county they're in, because at that point you're in the sales appointment. But again, Michelle, it's all in good faith. Just do the best that you can.
Right. Yeah.
Brian, I've missed you. Glad to have you back.
I will take her advice on looks.
Terry, welcome back. Terry goes, hi, Olivia and Kari. If a person has Part D with a Medicare and price doubled and they want to cancel, is there an SEP for an advantage? I'm not allowed to comment on the pant deal. Good call, Terry. Good call. So the ultimate thing is going on right now. Somebody's supposed to see.
Wait, let me see that question again.
So essentially, make sure I'm going to start answering. You tell me if you think I'm not answering the right part of the question. But we do know going into 2024 AEP, we can expect,
premium doubled.
Yeah, that's what I'm assuming.
Are you? Yeah, we
can
doubled?
And tell us if we're not talking about the right thing, Terry. But keep in mind, guys, the bids, what we're seeing for prescription drug plans is that premiums are likely to double, if not triple in some cases, because what the national average is going to be in 2024 is $64, and this year it's like $34. So it's going to almost double. So that is a great point, Terry. A lot of people are looking at Medicare Advantage plans thinking like, hey, it might be time to get my MedSup premium. Now my really high Part D premium, and I'm either going to drop my Part D plan and just hope I don't get prescribed and hope I don't, have to get back on it and get that penalty, or I'm just going to go to the Medicare Advantage side. So obviously during the annual enrollment period, which starts in T-minus 25 days, they would be able to do that for a January 1st effective date. Drop that Medicare. Just make sure if you do that, you actually cancel the Medicare supplement plan. Oftentimes, I see it every year. Somebody will enroll into a Medicare Advantage plan. They'll keep that MedSup. They're paying premiums on a plan they're not even going to use.
But the premium doubling itself is not.
The premium
does not create its own set.
No, so you would
have to use AEP.
You would have to use AEP or some other special election period. Yeah, but the fact that the prices have just gotten outrageous does not create a special election.
I'm really curious to see what happens with, my book of business is like
mostly subs.
80% supplements. So
I'll be interested.
I'm nervous for this AEP.
I'll be interested to see what you have to report on throughout AEP.
I'll report it.
Yeah, what your MedSup people are thinking. Why is the Medicare Cafe text line on so many bathroom walls? Brian, I can't say it enough. How much I missed you. Great question. So going back to that first question, how do we find out about how many plans are available?
Yes, I need a recap on this one too.
So there's kind of two ways.
Easiest way to do it.
There's kind of two ways. One way I'm not even sure I want to talk about because it's going to be complicated.
Talk about the easy way.
So the easy way, not that there is an easy way, but the foolproof way, right? It's going to be if you just grab the CMS landscapes. And so right now 2024 is not uploaded yet. They won't be until probably the 25th, 26th of this month if we're lucky. Okay. But what the landscapes are is that they're basically an Excel spreadsheet of every single plan available in the United States, right? And it breaks it down by plan name, parent company, contract number, plan specific number, max out of pocket, drug premium, it just breaks it down in a single spreadsheet. Mm-hmm. Now, in order to gain access to that, it's right now the 2023 is available and every year prior. So you just go, it's really confusing. I don't understand it, but you go to cms.gov. Go to the Medicare button. It's like on the top banner. Scroll down to the section that says prescription drug coverage, and then you should see their CMS landscapes. And they're talking about it has both Medicare Advantage and prescription drug plan on there. I don't know why it's under just PDP, but you'll have to take my word for it. So that you can actually, what you'll do is you'll put a filter on that list, and you can filter by Missouri county, and it'll tell you that. So then you'd actually have to count how many of those companies you represent out of blank. So you can filter to be specific to your county. The other way to do it is technology, and it's much more automatic, but I haven't seen it in action yet.
Okay.
So
something on the Medicare app, I feel like.
Yeah. So this is actually going to be a feature on Medicare Center. It's two phases right now. The first phase is actually going to be on the plan enroll side. Plan enroll is the personal URL function, meaning that is a website designed for you that is branded plan enroll, that people can go if they find it, they enroll themselves in a plan, it'll go ahead and you be agent of record, you get the full commissions on that, so on and so forth. On the plan enroll, on your personal URL, on your plan enroll link, you can actually click someone's county and it will default and say this agent represents X amount of plans out of this amount available.
Okay.
It's not on Medicare Center yet because they prioritize the consumer facing one first because that they have to. Uh-huh. The agent is expected to be, there's human aid on the Medicare Center side. It's all just automated on the plan.
But I still feel like when I think about the process of my meeting, like it is not the first 60 seconds that I'm going to be in.
I think that's fair. All good faith. All
in
good
that.
faith. What I think
I have a full good 5 minutes of getting to know somebody and hear about their grandchildren and where they're retiring from.
No, I get it. I think what CMS intends for you to happen is that they think that you're going to know their service area prior to the meeting, and so you'll do that research ahead of time. I don't know who has that kind of time. I don't know who does it that way. So again, guys, it's all in good faith. Just do the best that you can. Once you learn that, then tell it to them. Is that the compliant, rule for rule compliant method? It's not, but we have to just do the best that we can. And as long as you can prove that, you're set.
What do we have next? Can't we just say we offer X amount of plans with X amount of carriers?
Are you talking like if you're actually wanting to use the word X? Like, no, you can't do that. You actually have to put a number in there. But that is, because that is how it should go. I represent 20 plans out of the 27 available. And all those people say, well, what about if I've contracted all the carriers? I make sure that I do represent all plans in that area. You don't, because there's going to be some direct-to-consumer plans. There's going to be, what's it called? What's it called? Thank you. Institutionalized plans that you do not have the ability to represent. So you do have to actually do your research. But guys, just do the best that you can. Oh, so you're saying, what if can I just say, instead of comparing it to Medicare, to what's available, saying I represent 40 plans with 13 carriers? I will ask that. Ooh, I'm shaking the table. Earthquake. Okay.
Whoa.
I will ask that to our compliance officer, but I feel like I already know the answer, and that's going to be no.
Plans.
You have to state what total is available in that area. You can't just say what you represent. You also have to say.
Yeah, that would be way easier.
That would be way easier, but you also have to say out of
or
how many
40
available.
plus plans with 13 plus carriers.
I'll confirm with our compliance officer, but I feel like I already know the answer. But I'm willing to do the due diligence because I think it's an important question.
Sherry said, when sending out the AEP mailing to existing clients, couldn't we still use the more generic wording? Otherwise, wouldn't we have to break it out by county or area?
Yeah. So again, if you're sending out, your AEP list and you're sending out requesting, information reminder, this rule doesn't go into effect until September 30th. So this only affects anything you send out after September 30th. But yes, you can be much more generalized in saying, in Illinois and Missouri, I represent X amount of plans out of X amount of states, because you're sending it to a wider audience. You don't have to be as specific, because you don't want to I have to send this letter to this client letter to this client. So you can keep it more generalized, but you do still have to use that same verbiage. I represent X amount of plans out of X amount of plans in this area.
And where on SMS's website can we find all the disclaimers to help us put these on?
A couple different places. Number one is going to be our AEP toolkit. Just go to smsteam.net, scroll down, click the AEP toolkit. Even if you're logged in, it's going to be like, oh, you're not logged in. You're not authorized to see that. You are. You just have to re-log in. We have to be super not Oxford. What's that? Alcatraz? We have to be super, super locked down with our content, because carriers, they want to make sure that consumers have no access to it. So we have to double password everything. So Alcatraz adjacent. Alcatraz. That's not the Harry. That's the real one.
Yes.
Alcatraz. That's the real one. What's the Harry? Azkaban.
Azkaban. I think you mean Azkaban.
Yeah.
Azkaban. Alcatraz is the real one.
Alcatraz is the real one on the
I never
island.
thought about
Azkaban and Alcatraz.
Yeah.
Of
how
course,
similar they are.
Those. Of course.
Man,
I'm not the problem.
Definitely will.
J.K. Rowling did it. Anyways,
she's to blame.
She is to blame.
Man, Harry Potter was the best. Oh my God,
it
is the best.
It is.
I hope they never remake those movies. I'm gonna be so sad. Well, it's coming.
Them.
They're going to remake
Warner,
them someday.
Don't touch them. They are sacred to us.
There will never be a better Harry Potter.
No.
Than Daniel Radcliffe.
You are absolutely right. Have you seen him? We'll go back.
Yeah.
Sorry.
He can't play any other part in any other movie.
No.
Harry Potter.
He was Harry, and then he did Weird Al. He was Weird Al in the fake documentary on Weird Al, and he was actually pretty good on that. It was hilarious. When sending hopefully we answered your question there, Sherry. But again,
there was another one I thought.
Agent method.
The more generic wording on the website until they get to the point where they were actually searching their county.
Okay, sorry. Agent method had said.
I think Sherry was responding to whoever was asking about the general wording.
Yes, and again, that is true. Again, but it's all about what's general for you. If you're asking a call center, an agent who is licensed in all 50 states, general to them is going to look really different compared to an agent out of Northeast Missouri that does Iowa, Missouri, and Illinois.
Yeah.
So it is dependent on what is general. What you're it is dependent on what you consider general. But again, to Brian's point, guys, don't get held up on this.
Mm-hmm.
Do the best that you can, and you will be okay. If you are showing that you are making an effort to be compliant, that will go a long way. So don't get hung up on this. just do the best that you can.
I thought it was interesting that I think it was Humana. It was either Humana or Anthem certs. They had actual like questions in their certs about like secret shoppers, like just like plain saying that they were like having secret shoppers, which I've never seen that before.
Yeah. So we know that secret shoppers stopped in like 2018, 2019. Medicare CMS just didn't have the budget to keep that program alive, and they didn't need it at the time.
Yeah.
But carriers continue to secret shop. So carriers have continued to have their secret shoppers out there. However,
I just don't remember them asking a question about that.
There's a lot of secret shoppers this year.
Yeah.
So if you are doing an event, which we've covered events several times, and Senior Marketing Specialist University just did a webinar on the 3 different types of events that we recognize. And so double check on some of that stuff, but know that like if you're advertising it, chances are it's going to be secret shopped. So just be aware of that.
There you go. Michelle had a question. Is the 2024 sample AEP letter been revised and ready to use?
I love that question, Michelle. We are currently working on that still, because that one we actually did have to submit to CMS to get it approved because it's a marketing piece at that point. So that one I think the jury's still out on that, but the minute we get it back, we'll do an announcement on that. We're kind of waiting to hear back from CMS on some of those pieces that Senior Marketing Specialist makes and has made for the past 5-10 years. More to come.
Lots of questions. I'm loving
this
it.
Number of plans. What's the problem with? So Terry asked, this number of plans, what problem does this solve? So that disclaimer, Terry, the whole we represent X amount of plans out of X amount of plans, it actually is supposed to help people who, people who are misled by agents who are not independent, agents who work directly with a carrier, because agents who work like call centers for carriers, or let me word it like this. Carriers, it's very few and far in between that insurance carriers like Humana, United Healthcare, very few of them actually have their own internal call centers anymore. What has happened in the past few years is that call centers who used to represent a ton of different carriers couldn't function in that world anymore because of the updated compliance rules and regulations, and are now a designated call center for a specific carrier, and no longer have the designation to write for other companies. So you work with a call center, and they're the designated call center for Humana, designated call center for United Healthcare. They were being accused of, and I'll say it like that, of misleading people into saying United Healthcare or Humana or Aetna is the only option for me. It's the only one I have available.
Yeah.
So if I want a Medicare Advantage plan, I have to buy it with this person at this time, which was misleading because, as we know, in many areas, lots of plans are available. So it's supposed to let them know I represent 7 plans out of 10, meaning that there are 3 today that I'm not going to talk to you about. And if you want information on the 3 that I'm not going to talk to you about, go to Medicare.gov. So it's just designed to help be less misleading for maybe some people who weren't being completely honest in the past few years.
It is frustrating for people that are,
it is.
doing
all
it right.
All of this is frustrating. Yeah. And it all comes back to 2020 when CMS said we don't recognize any differences between a field agent and a call center agent. We don't, by the standard of the license, we don't there is nothing different between the two. So more coming on that, more changes. But yeah. Anyways, guys, keep the questions coming. We have a few more here. And again, we'll keep this going for the next about 5 more minutes. So any questions that you have, please let us know. One of the questions here is are we still having to worry about the chain of enrollment? The chain of enrollment was something that was really big last year. It was like the biggest update, the biggest compliance update.
I can't remember how many times I came in here and our podcast talk was chain of enrollment.
All about chain of enrollment. And just a reminder for those of you who are like waking up and just like, oh my gosh, those words are so familiar, but who is she? Chain of enrollment is you have to show every step from a person becoming a prospect into them becoming a client of yours. So were they a lead? Did they go to a meeting that you were hosting? Were they referral? So the answer to that, yes, that you still have to be able to track the full chain of enrollment. It is going to look a little bit different this year because on call recording, only sales appointments need to be recorded, not every service, not everything. Only the sales appointments need to be recorded. So that will look a little bit different as far as chain of enrollment's concerned. But like, I know you're going to continue to record all phone calls.
Everything.
You already have the system in place. It is worth.
It's more work to not.
Right?
It's more work to just record the sales, I feel.
Yeah. So, but we'd love any input on that. Anybody who is planning on only recording sales calls, let us know. Through Medicare Center, if you're using that one, it is easy to do because you can say, let me call you back my enrollment line. If you're using Medicare Center to call record and you don't want it to record all calls, you can do that. But like a lot of us, got so used to just recording all calls, there's no really big reason to discontinue that. Yeah. In fact, my call recording has saved my butt a few times because of the he said, she said.
I'm thankful for it.
Yeah. You were just telling about that the other day where somebody's like, you're dodging my husband's calls. You're not doing this. And you're just like,
you need to speak to your husband. Because let me tell you, we spoke like 6 times.
Yeah. So that is helpful.
Yeah.
Kind of feels like a high schooler, like, nuh-uh, see, look what they said. But, like...
So hard not to get like that.
Yeah.
But I really wanted to.
I love that. Another question that I got was basically asking, do we have the ability to mail apps still? And we haven't really talked about a lot.
Mail apps.
Yeah.
Interesting.
Not mail like M-A-L-E. I'm not assuming the gender of the app. I'm saying, are we able to use... the Polar Express?
I don't know if I've ever done that.
It's September. Mailing an app? Sorry.
So how do you mail it? Do you mail it blank and they fill it out?
No. So I'm glad we're going over this. Because as in some cases, it is still an option. E-app? A lot of consumers, not a lot, that's a complete lie. Some consumers either like they don't want to do anything internet, they refuse to do it. I'm looking at those who are like 75 and older. Yep. I really don't see that under 75, but that's 75 mark and older. I do see a lot of people who just refuse to get an email address, will not get a smartphone, just don't want to adapt the technology. So just a reminder, you can still mail apps. The process goes that you fill out the application, everything minus, of course, the client signature and the agent signature. What I recommend doing is mailing that app and, of course, all products with it. So the star numbers... Star benefits.
The star benefits.
Okay. Star ratings.
Star ratings.
Summary of benefits, all that stuff. Mail it to the client. Make sure you put on a sticky note, sign here, and then give them like a folder for them to mail it back to you. Postage back, and make sure they mail it back to you. Then when you sign the application, that's what starts the 48-hour ticking period of when an app is late. It doesn't go by the client signature. So if the client signs it October 21st and you sign it October 27th, you have 48 hours after the 27th to get that back in. So the agent signs it last and make sure the agent sends it back to you. But yeah, you can still do that.
That sounds complicated.
I
don't think I've ever mailed one.
It is.
I would rather drive there.
Yeah.
Or them drive to me to sign it.
Yeah, I get it.
Yeah.
But yeah, you can still do it. It's still an option. We see it every year. It's still gonna happen. If we enroll a Medicare Advantage plan on Medicare app, how do we then do the health risk assessment?
Some will allow you to do it.
Mm-hmm. Yes.
Our whole team has struggled with Humana's health assessment app through Medicare Center. Yeah. Most carriers at this point will allow you to do that. It just depends on the carrier. Some carriers will say they actually it's technical terms, and I am as tech savvy as a baby rabbit. But they do know that, like, if you do, there are some that, like, are external links. So, like, even, like, Humana doesn't own that. They outsource it. And so those can be a little harder for the systems to recognize. Yeah, because it just doesn't work.
Exactly. But it is still possible depending on it. We will make sure we publish Integrity is coming out with this really cool Medicare app, Medicare Center, Medicare Link side-by-side comparison tool to say this carrier is available on Medicare Center to do an HRA, but it's not on Medicare app, and so on and so forth. So they'll let you know that, and with the instructions on how to do it per carrier.
It's helpful.
Yeah, for sure. I think, so we are past our 10:30 cutoff. That was not the question. Brian, that's a great question. We should talk off air for that one.
Humana is changing the HRA vendor platform.
I know, yeah, I knew that there was a lot of struggling. If you guys, and just to be clear, if you guys aren't doing the HRAs, VBEs, basically
That's
the
just
test,
nonsense.
I'm telling you, I would say probably 10% of agents actually do it.
I've never had a single client bat an eye.
And again, you get that money, and you can get up to, some carriers are paying
part of the app.
Some carriers are paying $125 per app that you can do an HRA or VBE on, that you get. So, and again, I do highly recommend that you guys do those programs. Number one, it does actually show that it does keep the consumer more engaged, and they're much less likely to leave that plan during OEP. So it does actually make the plan beneficiary stick more.
Mm-hmm.
But then again, you also get paid for it. So just making sure every carrier will pay a little different.
It takes 60 seconds.
Takes 60 seconds. And it's just so easy.
Yep.
So just do it. So awesome, guys. Well,
just do it.
I appreciate all the questions today. I appreciate all the interactions.
And I learned something.
Good. I learned
something that I can wear now.
Oh my god. Red breeches. Under red underpants under white pants.
Dude, those HRA payments come in quicker.
It depends on the carrier, but most of them you have to wait until after the effective date. Yeah. They changed that rule because of all the chargebacks and all the plan switching during AEP. They used to say like during AEP, right? Like during AEP you'll get that HRA. No, most plans have switched it to after AEP receive that payment, just to make sure that client actually stayed on that plan.
Yeah, makes sense.
Yeah. So good question. Appreciate you guys so much. Just a reminder, Kari will now be joining the cafe every other week. After that, you'll have Clayton and then a surprise guest at least once a month. A surprise guest. So we got September's lined up. We're really, really excited to see that. So more things to come. But just remember, guys, our Medicare Cafe, as always, will continue to operate during AEP just for like 10 minutes, 15 minutes max. And just to kind of give you guys some updates on what's Kari seeing out there, what's our compliance officer seeing, what are the carriers saying, and just kind of giving you guys a status report throughout AEP. So stay tuned for that. Appreciate you guys hanging out with us. Again, text us number anytime. That is me, myself, and I. So please, please, please reach out. Thank you guys for paying attention to us, because that's what I want.
We had lots of interaction today. I feel like that was a record of questions.
Honestly, I'm here for it. So if you guys like this platform, let us know. We'll do it more often. But until then, everybody have fun,
make money,
and give impeccable service. Thanks.